Hi, my name is Thomas Shanley. I live in Oceanside, and I'm a patient of Dr. Ganesh Gunasekaran, and he did surgery on my liver, and I'd like to tell you about it. I was out at the golf course at Merrick, and I started to feel abdominal pains, and it continued to get worse and worse until it was unbearable. From there, I went to my primary care doctor, Dr. Sasko, and he did some blood and urine samples and sent me to the emergency room, and after an MRI was taken, they called Dr. Sasko, and he called me and said, you better get back to the hospital, bleeding from your liver into your abdomen. So from there, they sent me to the emergency room, and Dr. Gunasekaran came to visit me in the hospital. And after looking at the MRI, he said that we have a growth on your liver that's going to have to be removed. It was August 10th of 2022. Dr. Gunasekaran performed the surgery. He removed my gallbladder, and he cut out the cancerous growth on my liver. And he has been my doctor ever since. It's been a year and 10 months now. I spoke with Dr. Gunasekaran when people I've known in the past had cancer. They had to have either chemotherapy or radiation or both. But Dr. Gunasekaran was very confident that he had gotten all of the cancer off my liver. And he said, I don't believe that it's necessary to have either chemotherapy or radiation. And he was correct. A year and 10 months later, I'm cancer-free. And he said that I was one of the luckiest patients that he knew. First off, that the cancerous growth burst, because if it hadn't, I wouldn't have known it was there, and it would have grown worse and worse. And the second part was that it stopped bleeding on its own, which he said is not natural. That's most times they have to go in and stop the bleeding. So that was two wonderful things that I was happy about. He called me Mr. Lucky. My wife was, of course, a nervous wreck like anybody would be, and my children, everybody was so concerned. And we're healthy, and I have 3 beautiful children and 5 beautiful grandchildren. And summertime, we're swimming in the pool, and we're laughing, and life is good. And I thank Dr. Gunasekaran for all his work. He did a great job. Thank you.
Since liver, bile duct, and pancreas diseases are quite complex and need a lot of specialists involved, and to have a coordinated care, it is often difficult to make it happen in a place. And I think Mount Sinai has put enough resources in to make this happen in Long Island for the community here. For Mr. Shanley, I think he had a unique situation where we were able to do surgery and then get rid of the tumor before it could spread to different organs, was the key, and we were able to make that happen in a timely fashion. I think he really benefited from this program being in Long Island, and also the support he received from the family, friends, and the community. Sometimes it helps people to get through that phase.
Right.
The short-term recovery would be beneficial for patients who undergo minimally invasive operations. They can, after the operation, they can go home in 2 or 3 days. When you do the traditional, big incision surgery, they may take 5 to 7 days in the hospital before they recover. So it could help with the wound healing process, and also helps patients to get back on their feet faster when we do minimally invasive. But at the same time, we don't want to jeopardize the long-term outcome for our patients. So we assess every patient's situation differently, and we take into consideration what would work well for them in the long term.